What you are seeing here is an example of a laser eye surgery. The surgeon starts by marking the cornea. He then adds water to moisten the surface of the eye. He'll now precisely and carefully peel back the outer layer of the cornea. Believe it or not, this is completely pain-free for the patient. If your eye is a camera, you can think of the cornea as being the lens. You can see this amazing textured surface once the inner cornea is exposed. Now that he's successfully peeled back the flap, the surgeon will dry any excess moisture on the eye before proceeding. And now what the laser is doing is essentially reshaping the cornea, fixing the length of the lens, giving the patient perfect human vision in just a matter of seconds. The surgeon then adds a single drop of water over the treated area before spreading it, and then lots more water while closing the outer flap of the cornea. The water is used to smoothen the surface of the flap while closing it. Remember those marks the surgeon made in the beginning? He now uses them to line up the flap, making sure to close it exactly as it was before he opened it. And now he's just smoothing the flap further, making sure the cornea is back to exactly where it should be. Finally, the surgeon will dry over the incision, and lastly, adding some antibiotic. The patient can now blink and the eye will be fully healed within a few days, leaving the patient with perfect human vision. Here she is getting up from the operation. It only took a few minutes, and she is now glasses free for the rest of her life.